Inequity, a challenge nurses face. You can't say we don't need to wear it because PPE is running out. That's not fair. We're not stupid. We quickly realized that other parts of the hospital were given furlough, like days off with pay, because they didn't have the same operations going on. We were the ones that were working the hardest, but the other places were getting off work with pay, and it just didn't seem to make sense. We were working overtime and working twice as hard, and there were other people that could have come in and done some of the work. These words were said during an interview by ICU nurses when asked about their work experience during the COVID-19 pandemic. Unfortunately, those ICU nurses weren't the only ones who felt that way during the pandemic. Many nurses face moral injury and burnout in the profession due to different types of inequities. Some examples of inequities are, but are not limited to, pay disparities, overbearing workloads, voice recognition, and occupational safety. My research question that I will be studying and assessing throughout the school year is, can the inequities nurses face in the work environment and profession contribute to moral injury and burnout, as well as negative patient care? Now, all of us should remember the importance of nurses in our lives. Nurses are the most seen healthcare professionals. To become a nurse, you have to go through years of vigorous training, classes, and exams to become a licensed nurse. While nursing roles vary, most nurses carry out many of the same essential tasks. Burnout and moral injury stemming from inequities is not a positive thing, and nurses aren't the only ones who feel the effects of it. Hospitals and patients will feel the effects the most. Nursing shortages will lead to longer wait times, medication errors, increased expenses, and health disparities. I currently do my research with Dr. Holman and Natalie Nguyen, RN. Our topic of research is the associations between healthcare organizational leadership, the relational breakdowns that drive occupational burnout and moral injury, and burnout and moral injury among clinical direct patient care nurses. The four relational drivers that we are researching are distrust, lack of control, value conflicts, and the topic of my research, inequities. This topic of research is important for many reasons. The most important reason being that these inequities nurses face are preventable. They just need to be addressed through organizational leadership. For example, hospital directors, managers, executives, and administrators, and etc. Throughout my research, I expect to find that inequities nurses face do lead to burnout and moral injury, mostly due to that fact that there are many different types of inequities, and each one contribute negatively to someone's mental and physical health.